This is Dr. Alan Resnick, and today we're talking about tibiotubercle osteotomy, or otherwise known as a Fulkerson realignment. These are for patients that have malalignment of the kneecap. Because the tibial tubercle itself, this bone here, is malaligned and more lateral than it should be, creating force that pulls the kneecap to the side. Today we're going to just do a simple osteotomy to correct that, and I'm just going to demonstrate that the way I would typically do in the OR, of course, without any blood or soft tissues, so it's a little bit easier. So first I'm going to pick up spot and an angle to both bring the tibial tubercle medially and bring it anteriorly to unload the kneecap. So I'm going to do a little drill hole here, and I'm going to find, and that's pretty good. So that's going to show me the angle of correction and the angle of elevation. And then I have this special guide that I use, that I put on like that. My assistant is loading up the next drill bit, which should be this one, actually. So I'll get this guide, and I'm going to set this guide at an angle so that the osteotomy is going to be in this plane, but also tapered this way, so it's going to be thinner at the bottom and thicker at the top, and that helps us as well. And I'm going to line up the second part of the osteotomy here. So you can see that I'm more anterior with the distal part, and that'll be obvious in a minute why I'm doing that. And then in the OR, what I typically do is I'll drill a bunch more holes and use an osteotome. This is a plastic bone, and being a plastic bone, it's more difficult to do it that way, so I'm just going to use a saw